Hey everyone, welcome back to another video. In today's video, I'm going to talk about nursing school, and I'm going to give you certain nursing school tips that I think would be beneficial for nursing students. So let's get on with today's video. If you want to gain more information about nursing, please consider subscribing down below. Also, be sure to check out the description box where I have different resources you can download absolutely free, such as a NCLEX guide, how I passed my NCLEX, and a free ebook on fitness and nutrition. Also, I would greatly appreciate it if you give this video a thumbs up. It took me a long time to make this video, so it would mean the world to me if you gave this video a thumbs up, as it would help other people see this video. So let's get on with today's topic, which is some tips for nursing students and for nursing school. So the first tip I have is the medical surgical component of nursing is very critical in order for you to practice safely and effectively. So try your best to focus on this area, and as it will help you on your NCLEX. So, there's a lot of different courses you're going to be taking in nursing school. However, the most useful course, and the one that I really want you guys to study, is medical surgical. And that is because it is so useful in your everyday practice, no matter what you want to do. If you're able to get a really good grade in med surg, that means that you're able to, be effective in the care you provide. You're able to have a greater understanding, and you're able to provide great care for the patients. All of these things are really important for a nurse, of course. So being good in med surg is really, really important. So if you had a choice between, other types of courses you have in your term, I would really emphasize studying extra and more on med surg. I would even go as far as purchasing, nursing.com has a great resource for nursing school students and med surg. So I would highly recommend, even if you can, I know nursing school is already so expensive, but I would recommend investing in nursing.school.com's program for nursing school students and focusing and reading the different topics that they provide for nursing students for med surg. The next tip I have is for you to be curious in your clinical rotation. So ask a lot of questions in your clinical, guys. You're in that setting for a very short period of time. If you think about it, I did my clinical, let's say I got to the floor at 7:30. I would leave at 3:30. I would get a 1-hour break. So if you break it up, you really only have 7 hours. Oh, I forgot to mention, you also have post-conference where you talk about, what you saw and what you did. So you really only have 6 hours of hospital experience when you're going into clinical. At least that's how it was for my clinical site. So if you're really interested in a specific field, make sure that you ask a lot of questions. You try and always ask if you can watch certain procedures, and don't hesitate to ask nurses questions and ask them if you could watch. Another tip I have is a lot of times in clinical, you're going to get, you're going to start off with 1 patient, then you're going to go with 2 patients, and then 3 patients. And by preceptorship, you're going to have 4 patients, and you're going to take the whole workload. As you're working yourself up to those patient loads, make sure that, if you have spare time, you first of all know everything about the patient that you have. So, research all their medications, try and look at their mechanism of action for different medications that they have, search their different comorbidities, and know the pathophysiology of their different comorbidities. And then if you still have free time, try and help out the other nurses. You're working in a hospital and other nurses have a shift that, they're busy, and sometimes that call bell might be to just grab them a glass of water or get them a warm blanket. And if you're able to help them, it goes a long ways, and they'll remember you, and then they will be able to provide you with better learning opportunities. For example, I remember in my clinical practice, I helped out this one nurse and she was like, oh, that's not even your patient. Thank you for helping me. Hey, do you want to insert an NG tube? And that's how I learned to insert an NG tube, because that nurse was like, you know what, if you help me, I feel like it's an obligation to help you. So always trying to help out in any way possible you can, even if it's not your patient. Of course, make the clinical judgment to make sure that it's something safe that you're going to do, such as transferring a patient to the bathroom, or giving them a blanket like I mentioned, or water, or whatever the case may be. So help out in that way. It's also beneficial to do that because say you apply for a job there and a nurse notices you and is able to provide you with better resources, or give you tips, or they might help you on your first orientation shifts so that you're able to be successful. So creating a good rapport with the nurses by just doing a little bit extra and helping them out goes a long ways. So I'll tell you a story. In my maternity rotation, I personally wasn't really excited about maternity, but there was this girl who was really, really interested in maternity, but she was a little bit hesitant on, asking the OB questions, because she's like, oh, it's the physician, I'm just a nursing student, this and that. But in my opinion, they're always willing to give students an opportunity to watch and learn. So I went up to the OB and asked them, hey, can I watch a C-section? Now, to give you a kind of a backstory, every person in my clinical group got to see one C-section during their maternity rotation. But that girl was really interested and wanted to see another one and wanted to see other cool things. And to be honest, maternity wasn't my specialty, but I just really thought it was cool. So I already had seen a C-section, but I was like, you know what, whatever. I'm only here once. I'm never gonna work I'm never gonna go to a maternity floor anyways. So I went up to the OB and I said, hey, can I see the next C-section you do? And she said, yeah, sure. You can, I'll page you overhead so that you can come into the operating room and see the next C-section. So, I was like, sweet, that's so cool. And I told that girl that I got an opportunity to see another C-section, and she got so jealous and she was so upset that I got to do that. But essentially, I just asked, and so I always tell nursing students, don't hesitate to ask. The worst case scenario is that cardiac surgeon that's inserting a pacemaker will say, no, I'm not going to let you come into the operating room. Or they might say, yes, you have an opportunity to see something really, really cool. Or, in this case, it was the C-section. But to end the story, I essentially was on my lunch break, and apparently they paged me overhead, but I was in the lunch break, in the lunchroom, and you can't hear pages in the lunchroom, so I didn't get to actually see the next C-section, but my second C-section. But the moral of the story is, don't be afraid to ask to see cool things from providers. They've been there for a long time, and at one point they were students as well, so they're more than likely to say yes to different opportunities for you to see cool things. The next tip I have is to create or to buy a special book where you write down all the different medications or comorbidities that your patients have throughout your whole nursing school, and that essentially will help you in so many ways. Firstly, it will help you refresh yourself on, if you're going to orientation for your first day at work, you're able to recall back all the different patients you had and what you had to do, and it will ease your anxiety. Another thing is, if you write down all the comorbidities and you research the pathophysiology about coronary artery disease, and you find out that why aspirin is given and why atorvastatin is prescribed, all these different medications, it will not only prepare you for the NCLEX, but it will also help you get better grades in nursing school, because that's essentially what they're going to ask you is the different pathophysiology for different comorbidities, and you being able to explain why you need certain medications for certain comorbidities. So there's many benefits into creating maybe a list you might have on your iPad or your laptop. I personally bought $5 notebook from Staples, and I brought it into every single clinical shift, and I wrote down different comorbidities patients had and different medications that I thought were constantly reoccurring, or all the medications I had no idea what they were. I wrote them down and I tried to memorize them so that, the next time I went to clinical I was better prepared. Anyways, guys, those are some tips and tricks I have for nursing students going into nursing school. I hope you enjoyed this video. If you did, please consider giving it a thumbs up. Let me know what your thoughts are in the comments down below, and we'll catch you in the next video.